Hi everyone, it's good to be with you again today. Um, we continue to come back. We said last week, this is the Icmfel medical reality talk show. Today, we're not going to have in live guest with us. Today, we'll be talking about breast cancer, and next week, this month is about breast cancer. But we don't have our guests joining us live today in here. So, we want to let you know as well what's going to be playing today. This is one of our awareness video from 2 years back. Yeah, 2 years back, but the contents and information remains the same. And so we join in concerning breast cancer this year again from our team at Icmfel. All of our team members from different specialty will be early out the message about breast cancer this month. So you're going to be hearing me, you're going to be hearing Dr. We did that 2 years ago plus when I'm still a resident. I'm attending neurosurgeon. And you're going to hear Dr. Eleanor from Ghana, Dr. Faustine, Dr. Victoria, now in the US, they were in China at the time. But yeah, we just joined our verses to the many verses concerning breast cancer this month. We want to say thank you for joining us. Thank you for following us. We are glad to be here today to continue to talk about what matters and what are some of the reality that we think we need to create awareness about. So follow us as we progress. So just skip to we coming to you live from a message from last year. Here we want to welcome you to the 22nd edition of the International Christian Medical Fellowship, Icmfel for short, medical reality talk show. Wow, we gone 22nd edition. We've been here a while, right? So joining the awareness this month for breast cancer. So we're going to be talking about breast cancer throughout this month. But this edition of our show, we're going to have our team here at Icmfel from different area of specialty. But we're going to be adding our verses to create awareness on breast cancer. Breast cancer is the frequently diagnosed life cancer in women and is the leading cause of cancer death among women. And so, of course, that is me, and we are all afraid of other diseases, and we worried about the death rate, the mortality rate of other diseases, including other cancers. But yes, breast cancer is of essence, it's a medical reality that need to be talked about. So today we on this edition, we're going to be giving a basic definition and the etiology, that is the causes of breast cancer. Then we will talk about some of the risk factors and signs and symptoms, bringing clarity what are those clinical presentations any doctor or any ordinary person will see that will raise alarm and to be able to seek early diagnosis. And what are some of and the treatment available for breast cancer? So that is what we're going to be doing on this edition of our show. On the 22nd of this month, as we continue talking about breast cancer, we're going to have an oncology, that is the specialist in treatment of cancers, and she's going to be joining us as we host her to discuss in details. Also, we may not have all of the time to say everything about breast cancer, but the specialist in oncology will be there to further give much more details about the discussion. So today we want to encourage you to join us. We are trying our best to make it as simple as possible, and so that many people can have the information, so that people, if before even going to hospital or seeing a doctor, can be able to detect if they are at risk, or if there is a situation or clinical presentation of breast can be quite helpful. So welcome to John, this 22nd edition today as we discuss breast cancer.
Hi, my name is Dr. Eleanor Annan of the International Christian Medical Fellowship. Welcome to today's show. October is all about breast cancer awareness, and today we'll be adding our voice to the awareness creation. We'll be talking about breast cancer. My other colleagues will be talking about the risk factors, signs and symptoms, clinical presentation, treatment, and prevention. So stay tuned and let's enjoy. All genders are at risk of getting breast cancer, male or female. However, the risk is higher in female than in male, and that is why in awareness creation, more attention is given to the female. But when there is a change in breast for any male, it's good to report to the health facility for examination and early treatment. Breast cancer. We have various kinds of cancers: the lung cancer, prostate cancer. Breast cancer is cancer that begins or starts from the breast. As we all know, the breast is the extension in front of our ribs, in front of our chest, and it differs from the male and the female, in that the female adult breast produces milk. In male, during puberty, the male hormones, the testosterone, prevents or stops the further development of their breast, and so exteriorly you would only see the areola and then the nipple, and beneath the underdeveloped milk ducts. But in female, ours is more developed. The breast is made up of the lobules, the ducts, and connective tissues. The lobules are the glands. The ducts would carry milk to the nipple, and then the connective tissues are the fats and others that hold the breast together. When it comes to cancer, is or breast cancer is when the cells in the breast multiply uncontrollably. So the excess cells will start forming growth or tumors, and that is how they start. And they can start from the lobules, or they can start from the ducts. And when they are found in the lobules, we call that lobular carcinoma. And when they are found in a duct, when they start from the duct, we call that ductal carcinoma. They can be invasive or they can be in situ. With invasive, they start from the they start moving away from their origin, and then moving to other parts of the breast or other parts of the body. However, they are just situated where they started from. They've not started spreading to other parts. Although not fully understood, research shows that breast cancer is as a result of genetic mutation or damage to the DNA. And breast cancer 1 and breast cancer 2, BRCA1 and BRCA2, and estrogen exposure have been associated with breast cancer. Breast cancer is one of the frequently diagnosed life-threatening cancers in women, and it's also one of the leading cause of cancer death in women worldwide. But the good thing is that with awareness and early detection, death has now steadily been declining. And so I would encourage everyone, male or female, to take advantage of this month. Get screened. Love your boobs. Know your boobs. Examined. Shalom. God bless.
Hi there, my name is Dr. Victoria Maniele, and I am here to talk about the risk factors as well as the signs and symptoms of breast cancer. So, what are risk factors? Here in the medical world, risk factors are things or factors that increase your chances or make you more susceptible to having or developing a certain condition. So for today, we're going to look at the risk factors of developing breast cancer. Let's get started. So the first risk factor, which is the most obvious and sad of them all, is just being female. Increasing age, having a family history of breast cancer or a personal history of breast conditions, inherited genes that can increase your cancer risk, such as the BRCA1 or BRCA2 gene mutations, increased estrogen exposure. What do I mean by increased estrogen exposure? Don't we already have estrogen in our bodies already? No. What I mean is normal levels of estrogen in your bodies. When can this happen? Nulliparity, not having children, having an early age of menstruation and a late age of menopause, taking hormone therapy, or we call them hormone replacement therapy, and also obesity can actually increase the chances of having high estrogen levels because the fat in the adipose tissue is converted into estrogen and then increasing the level of estrogen in your body. As well as postmenopausal obesity can also be a risk factor as well. The increased number or increased total number of menstrual cycles that a lady has, the absence of breastfeeding during pregnancy, or a late age and pregnant. By this one, we mean having kids later in life, in a later age in life. The increased alcohol consumption and radiation exposure. So let's summarize the risk factors that we have learned today. Increasing age, genes, family history, radiation exposure, obesity, alcohol, gender, a personal cancer or a personal breast conditions, early menstruation, late menopause, having your first child at an older age, never being pregnant, and hormonal therapy. So these are some of the risk factors of breast cancer. So now let's see the signs and the symptoms of breast cancer. So because this is Breast Cancer Awareness Month, we here at Icmfel wanted to put this out there so that this information can be available to more people and that people can have the access and the knowledge of what could be a potential risk or what could be a potential symptom of breast cancer. So we hope this helps you and the people around you. So let's get started. Breast pain or nipple pain, retracted or inverted nipple, lumps. You could have lumps under your collarbone or under your armpit, or nipple discharge, swelling, redness, the change in the skin texture around the nipple or on the breast. Some have even complained of redness, itching, darkening of the skin. There could be even changes in the shape or size of the breast as well. Some have complained of breast puckering. Some people have complained that, even in their postmenopausal stage, they can have breast pain as well. Skin dimpling that looks like an orange peel, the the fruit orange, the peel around it. So we call that skin dimpling, or it could resemble that. Also, just changes in your breast from its normal state. So these are some signs and symptoms of breast cancer, and I hope this helps you and those around you. Take care.
Hi, so I'm Dr. Augustine Kebala, and part of the team today, I'm going to talk about the clinical examination and the diagnosis of breast cancer. So, my colleagues before me gave the definition, the etiology, and then Dr. Victoria just talk about the risk factors and the signs and symptoms. And so, there are three things we consider, right? So the history, the clinical examination, and then the evaluation or the workout, the test that we're supposed to do to be able to confirm that. So Dr. Victoria just talked about the risk factors and the signs and symptoms. So all of what you mentioned there is actually what we asked for in the history. So you could have all of those risk factors, being a woman, and then family history, you could have all of those signs and symptoms that you mentioned, the size of the breast and the skin changes, the nipple and all that. But you could not have breast cancer, even though you have all of this history. But you could also have breast cancer. So the history, having the sounds and symptoms, especially when you're listening to lectures like this, and then you go and do your own examination, you find all the things that is very, very scary. So what I want to say is that no, that just the first phase of the diagnosis. You could have the disease because you have all of the risk factors in the signs and symptoms, but you could also not have the disease at all. So the second phase that you go to when you find these signs and symptoms is what I'm going to talk about quickly, especially for breast cancer. So if you have the risk factors and you have the signs and symptoms of breast cancer, you need to see a doctor that will confirm whether these signs and symptoms have clinical significance. When I say clinical significance, for example, you have changes in your breast size. It could just be a physiological change. Some people have, one of their breasts bigger than the other, but it's not because they have breast cancer. But yes, change in your breast size could murmuring in there. So you need a doctor to be able to confirm that whether the changes in your breast size has a clinical significance. The second thing when it comes to breast cancer clinical examination, the change in the skin color, right? So if you have changes of your skin color, especially around the breast, that sound of breast cancer, but you want that to be confirmed clinically. So doctors with experience in clinical knowledge should be able to confirm that that is actually a sound, a clinical significant for breast cancer. So like the breast, you will see, especially the color of the breast changes. You have the orange kind of skin appearance, and so by you just looking at the changes in your skin color, especially on your breast, and you not being a doctor, you don't know the clinical significance. But yes, it's to get that, but then it's good to see a doctor to be able to confirm in the skin color is actually of clinical significance, and then that will help with early diagnosis. The third thing is the nipple, right? There could be changes in the nipple. Again, the changes in your nipple could not mean you have breast cancer, but it could mean you have breast cancer if it has clinical significance. So, for example, you have an inverted nipple, or you have a change in the color of your nipple. And the last one is discharge. You could have a breast, your breast having a discharge, breast discharge, and sometimes it couldn't be breast cancer, but it could be breast cancer. Again, clinical examination will prove the significance of that discharge. Lastly, lumps, right? Axillary lumps. You could have lumps on your arm, but it could just mean maybe it could be harassing. But yes, clinical examination will confirm all of those signs and symptoms have clinical significance. So whenever you have those signs and symptoms, it's good to see your doctor to be able to confirm the changes in your breast size, the change in the skin color, the change in the nipple, the discharge, and any lumps growing anywhere around your breast or on your arm. These are the key clinical examination of significance. Lastly, when it comes to the diagnosis, the evaluation of workup. So for breast cancer, we could do a mammogram. It's actually just X-ray of the breast, and they could do an ultrasound as well to confirm that. And lastly, they could do MRI as well, and they could also do a biopsy. The biopsy is used to be able to check what kind of cells in your breast that is growing uncontrollably, and that could help with treatment method. Thank you.
Hi there. So my name is Dr. Faustin, and I'm currently in China, where I'm doing my master's degree in cardiology. And today I'm going to talk about treatment and prevention of breast cancer. So without further ado, I'm going to talk about it now. First, let's start with prevention. How do we prevent breast cancer? You'll hear out there people will talk about the fact that you need to do screening every year, you have to do mammogram, you have to do ultrasound every year. I'm here to tell you something. The first prevention starts with family history and self-examination. So if in your family you have somebody, or you know of somebody in your direct relative who had breast cancer before, then this is out there for you. And if you think of like parents, sister, and all, because of mutation in some gene called BRCA gene and BRCA1 and BRCA2. So for people those kind of mutation, there are more mutation actually. I'm just taking one example. So people who have this type of mutation, they tend to develop breast cancer. So for prevention, what do? Usually we can do yearly checkup, especially when the person reaches a certain age. Most of the time we recommend after 30 years old. So we'll do yearly mammogram. And if the person does not have any prior history of that, then what do is we still do the checkup, but this time it's going to be a little bit later, and we check up all the way until they reach a certain age. So a person who has a family history of breast cancer from their mom or the sister. So there are certain ways where we can give drugs to delay the menarche, like the onset of period. So then they will not have any surge of estrogen in the blood. And self-examination is very, very important. This is especially for people who think they don't have any history or they don't have to prevent it and everything. So I think some of the doctors who came before me express or explain how you can do self-examination of the breast, which angle and how to do it. It's very, very important. Even the lifestyle is really important to prevent breast cancer. The thing we eat, the type of exercise we do are really, really important. And I will advise you guys to do more research on that. And because this is a disease that we can prevent. And there is one thing I want to add about prevention, especially using mammogram and ultrasound. These tests do not decrease the incidence of breast cancer. They just give us awareness, how to treat it early, and also reduce the mortality of these diseases. So without further ado, now I'm going to talk about the treatment. The treatment of breast cancer, as everybody can know, if somebody has a breast cancer, the first thing we have to do is surgery. Some other cancer, we start with, more conservative treatment, we give chemotherapy and all. But for breast cancer, surgery is the key. We can either do the total mastectomy, where we remove the whole breast, or we can do the lumpectomy, where we remove the lump, like a little lump of breast cancer. And then after that, we check the lymph node, the little dot which are on top here. We check. If we do the lymph node dissection, we see that there are more than 3 groups of lymph nodes that are infected. What do? We start doing the total mastectomy, and the breast together with the lymph node, we remove everything. And then after that, what if chemotherapy or radiotherapy? So those are the type of treatment we do, and it varies depending which country you're from, what type of practice you went, general surgery or breast surgery. But most of the time, those are the scope. There is surgery that comes first, and then there is adjuvant, which means after surgery, adjuvant chemotherapy or adjuvant radiotherapy. And on top of that, for those breast cancer that are positive in estrogen or progesterone, because estrogen and progesterone are the type of hormone that can be positive in the breast. So if a breast cancer has a positive estrogen, we give drugs, and those drugs are inhibiting those receptors, so they decrease the onset or the cancer. So this is a subject that's very broad. It's a subject that requires a lot of time to cover. We don't certainly have here on YouTube or Facebook. So if you want to know more, inquire more, you can contact one of our board members, the people who work with us, so we can give you more advice and more insight on the breast cancer. With that said, thank you so much and stay blessed. Bye-bye.